This is Martin Giles of the Guildford Dragon News, and this morning I'm joined by Louise Stead, the Chief Executive at the Royal Surrey County Hospital. Thank you very much, Louise, for giving us your time this morning. How is the Royal Surrey coping with the extra demands placed on it by the coronavirus epidemic?
So I think we are coping well. It's a very stressful time, as you can imagine, for staff and patients. But I think that, we're a clinically led organisation, and I think we are absolutely putting the needs of the patients and putting our clinicians at the forefront of every decision we make. So I think we are definitely feeling the stress, but we are coping, and there is definitely a sort of calmness around the trust as we go through every day.
Now, there's a huge show of support and appreciation for what health workers in all areas of their work are doing for us at the moment. And you are our community hospital. You're where we go when we're in medical trouble, and you see our babies into the world and our elderly people out when it's the end of their life. Does everyone there feel that wave of support for them?
Absolutely. I mean, I think it's nationally, from the sort of clapping on Thursday evenings, which people might think, oh, well, is that a sort of slightly meaningless gesture? It absolutely isn't. And I think people are really feeling the benefit of coming outside their houses and hearing what the local community feel. But actually, day to day at the Royal Surrey, we've seen the most amazing support. So Surrey Drive, who are providing us with free meals for our staff, so you can come in, you get a ready cooked meal to take home. I haven't got to cook at the end of a day. We've got fruit and veg being delivered every day. We've got 4,000 Easter eggs arriving from Mars this week. People have and smaller people who are coming in and just giving us cupcakes and smoothies, and we're delivering those directly to our A&E staff and our ITU staff, and really trying to make sure that staff who are dealing with corona patients every day and who are unable to come out of those areas are also getting their share of what's being delivered. The support from the community, unbelievable. We're really grateful.
Okay, now what's the best way the public can continue to support you?
So I think that there are several ways, I suppose. Making sure that we are maintaining social isolation really helps. Surrey Drive is doing a big piece around collecting donations to help continue to provide those meals, so we're really appreciative of that. But I think there are bits about supporting us by donations, but there's definitely things about looking at social distancing. The other thing I'd really like to get across is if our A&E is still open for patients who are COVID and non-COVID, so please contact your GP if you're worried about your health. We've had 2 situations recently where people did stay at home a bit longer than they should have done, and actually they've got themselves into a situation we wouldn't have had they arrived at their GP or at our doors a little bit earlier. So please don't worry about what would happen if you come into hospital. We are very clearly demarking our COVID patients, potential COVID patients, and our ones that definitely aren't. And hospital care is there for you still, and particularly GPs as well, who are really happy to take phone calls from patients.
Well, obviously that's an important message there. Have all your staff now got all the protection equipment they require?
So it's a continuing day-to-day situation, that, to be honest with you. So from the beginning of this week, there is a new logistics solution for that's been set up nationally by the Department of Health, supported by the Army. So that is coming into play now, and absolutely should improve what happens. But at the moment, it's being delivered on the people with the greatest need are getting delivery first, which is entirely appropriate, which means that you can't really plan and say, I'm going to need something in 3 days' time, because currently the logistics are coping with the people who need it tomorrow. So it's pretty much hand to mouth, I would say, at the moment. That doesn't mean we're not getting what we need, and we're really lucky because our procurement function here is very, very good and very hot on it. But every day we're looking at every element of PPE and ranking whether we're green, amber or red on the availability of that, as is every other trust in the country. And we are aware that it's a national crisis and we have to balance that out from the demand. So the London hospitals, which are experiencing that real surge at the moment, are obviously top of the list. And we are balancing that out across the country nationally.
I see. And what about the extra oxygen supplies you might need and the ventilators? I know there are different methods of helping oxygen supplies to patients, but do you have all the supplies there that you need?
So oxygen, we are hopeful we will be in a much better position after tomorrow. We've got some new oxygen coming online from tomorrow. Ventilators and also the machines for doing non-invasive ventilation are obviously a bit of an issue across the country. The XL has taken a great number of those ventilators, but there is a new process now whereby we can go through and try and increase what we need based on the daily need we have. I think what we should get across is what the Department of Health is really pushing is mutual aid. So as part of Surrey Heartlands, looking at what we need in relation to our other local hospitals and moving equipment around to make sure we are coping with what's happening in our local environment. So I think that's really where we are regarding ventilators. But oxygen, we are hopeful we are getting an increased supply online from late today or tomorrow.
Can you say how many COVID-19 cases you are currently dealing with? Those figures aren't published, are they? As a hospital, I mean.
They're published very openly to our staff, and I've already said the numbers this morning on BBC Surrey. So 64 patients at the moment with another query 20.
Okay. And are you expecting those to rise? Because there is some indication that the curve is flattening, but it's very early days, and it's not perhaps it's not too reliable. But what's your expectation in Surrey? Because it might be a bit different than London, might it?
Yes, I mean I think we were all working to a peak in the next week or so. As you say, the curve has flattened slightly. And the numbers that we modelled originally, we are not there at the moment. We are seeing a high demand for ITU, and so we've got two other areas of the trust. We've got a sort of step down ITU for patients who are having high oxygen therapy. So those numbers seem to pretty much be modelling, but not quite at the level we thought. So it does look exactly as you say, as if the curve has slightly flattened.
Okay, but you're expecting a bit of a surge in the next fortnight, is that correct?
Yes, well, I think that is the national modelling. We are expecting numbers to increase, and that's why it's so important that people continue with their social distancing and staying at home, because obviously that is what's really going to make a difference. Okay. And all the modelling has been based on scenarios of people following that guidance at various levels, if they follow it at 50% or 75 or 90%. And you can absolutely see how the curve would flatten if we followed it at 90%.
And do you have all the testing kits you require?
So we have the ability at the moment to test patients, all the patients we need to, and tests are being turned around in approximately 20 hours, which is really good. That's because a lot of this testing is being done on site. Staff testing, at the moment we can test up to 100 staff a day. That is fulfilling what we need to do at the moment.
How now your staff are in the front line of this, obviously, and the risk of infection to them is present. How many staff are off sick or in isolation because of the virus? Are there any inpatients amongst your staff?
We have got about between 13 and 20% changes, either off sick or self-isolating. And obviously the difficult for your family who is positive, we don't want those staff coming in and look to get any. I think along with them, we have staff who also have COVID, whether they have got that from being in the hospital, whether they've got that from a community-based infection, it's obviously impossible to say.
Okay. How many former NHS colleagues are you expecting to help? Are they already joining you to assist in your operations?
So they're going through the process. So we've got so everybody who signed up for that national database is being sent out to the local trusts, and that process is going through at the moment. So I'm not sure. We've got 40 support workers. So 40 nurses, 35 doctors. Sorry, I'm being given the exact numbers here.
Understand, completely understand.
40 nurses, 35 doctors we've got who are locally looking to come back and work with us, and we've got about 50 support workers from the NHS volunteering programme, which I think I'm meeting this afternoon. So all of those are fantastic local response.
Yeah, that considering your sickness rate, that sounds like a really critical part of the operation.
Yes, absolutely. But okay. I think our sickness rate is very much in line with national average.
Yes, okay. Now, finally, do you have a message? I think you've already given several messages for us, but is there an overall message you would like to give now to the people of Guildford?
So I think the people of Guildford should be exceptionally proud of their local hospital, and particularly of the staff. And when I say it's obviously doctors and nurses and allied health professionals are on the front line of this, but actually all the people who are going in and cleaning the wards with COVID patients and delivering meals. We're asking people to step into out of their comfort zone and look after patients and care for our hospital in a way we've not asked them to do before. And we're not seeing anybody who is stepping back from that challenge. We're seeing everybody who is going forward. We've got back office staff who are asking what they can do to help. Absolutely, we have got staff who are, they're worried about themselves, but they're still coming into work every day. They've got their families who are worried about them going home. And we've really, really seen an organisation pulling together and going the extra mile to try and do the very best for the patients we've got.
Well, I know from some of the comments we've received that there is tremendous affection, respect and admiration for what everyone there is doing. So thank you very much.
No, thank you very much.